Welcome to the Winning Medicare for All state by state, learning from the example of Washington State plenary session. My name is Chuck Pinocchio. As president of One Payer States, a 12-year-old consortium of 20 state-based campaigns determined to model a national single-payer solution, I am thrilled to facilitate this plenary roundtable at Healthcare Now's annual convention. Again, it's entitled Winning Medicare for All State by State, Learning from the Example of Washington State. For the state that is geographically as distant from any other state in our continental US, Washington has a storied journey that is perhaps the most instructive example of how we may reach the national single-payer solution sooner than anyone can imagine in our crisis-ridden environment. For out of crisis comes opportunity, and Washington State serves as a beacon to be studied, admired, and replicated by other states and national lawmakers. Our three presenters today are Cris Currie, Bevin McLeod, and Kelly Powers. Cris will start off here speaking to the history of Washington State's campaign for guaranteed comprehensive health care for all from 1987 until 2019. Bevin will pick up the discussion about the grassroots campaigns from 2019 that gave rise to the Washington Universal Healthcare Commission work group. And late last year, she'll speak to the passage into law of Washington State's permanent Universal Healthcare Commission. And then Kelly Powers will pick up the discussion about the inner workings of Washington State's permanent Universal Healthcare Commission as it moves closer to establishing perhaps the first in the nation Medicare for All state model. Just a few words about each of our participants, a little bit of background. Cris Currie is a retired RN from Spokane, Washington, and has been volunteering with Healthcare for All Washington for about 6 years, working to promote both a national Medicare for All system and a state-based single-payer system for Washington State. Chris's primary contribution has been writing and continually updating an interactive ebook called A Medicare for All Q&A that is available at Healthcare for All Washington. It's actually healthcareforall.org/resources that we'll share on another platform. Cris will discuss again the history of Washington State's campaign from 1987 to 2019. Bevin McLeod is co-author of Washington State's Permanent Universal Healthcare Commission. Bevin's background spans an array of projects in healthcare policy reform, community outreach, nonprofit management, and agricultural and economic development. At the Alliance for a Healthy Washington, Bevin streamlines the advocacy work of numerous stakeholders, breaks down barriers to access, and promotes education to influence meaningful change in healthcare policy. Again, Bevin will pick up the discussion from 2019 to the present. Kelly is our third presenter, and she is buffeted by spiraling ACA premiums, formidable cost sharing, and narrow networks. Kelly was appointed consumer representative to the Washington Universal Healthcare Commission work group. She formed the Healthcare is a Human Right Washington coalition in order to exclude cost sharing from to exclude cost sharing as a principal feature of the Universal Healthcare Commission's work group's focus on affordability, thus taking a giant step toward establishing a single-payer system in Washington State. And again, Kelly will discuss the inner workings of that Universal Healthcare Commission. So at this time, let me turn the microphone over to Cris Currie, again, to discuss the history of the Washington State campaign. Cris?
Hi, thanks, Chuck. I'm going to talk a little bit about the history and then go over a little bit of information about federal waivers and about how we might be able to work around the ERISA preemption. Have the slide one, please. It might seem like Washington's current Universal Healthcare Commission just happened overnight, but in reality, the state has been pursuing significant healthcare reform since its establishment of the Basic Health Plan of 1987. which initially provided state subsidized health insurance coverage for about 24,000 residents, mostly dislocated timber workers. And it was hailed as the first program of its kind in the country. And it started a progressive change of meaningful reforms that really shows no sign of slowing down. And in 1990, the Gardner Commission was formed to put together what became the Health Services Act of 1993. But as luck would have it, the Republicans came in and rescinded most of the law in 1995 before it could be implemented. But fortunately, the basic health plan survived, and the rest of the legislation became the basis for Romneycare in Massachusetts. And that was actually became sort of the fundamentals of the Affordable Care Act. So this was definitely a state effort that heavily influenced federal legislation. Next slide 2, please. Accessing Washington bills and laws is really easy at these websites. Washington's first single-payer bill was filed as Initiative 725 in the spring of 2000 by a group called Healthcare 2000, which became what is now called Healthcare for All Washington, aka HCFA. It failed to gather enough signatures since it was an all-volunteer effort, but the proposal was later transformed into the Washington Health Security Trust Bill with the help of several supportive legislators, and we pronounced that WHOST, Washington Health Security Trust. Notably, Initiative 773 was passed the next year, and it greatly expanded the basic health plan with funding from a new tobacco tax. The BHP came to an end with passage of the Affordable Care Act, but portions of it were also incorporated into that law. Another provision incorporated into the ACA that was originally Washington legislation was the provision that permitted unmarried dependents to be carried on their parents' insurance until age 25. And then Apple Health for Kids, our local Medicaid program, began in 2008, and now, incredibly, all kids in the state are considered covered with health insurance. So Washington's single-payer bill is called the Washington Health Security Trust. It was first introduced in the 2011-12 legislative session by members of Healthcare for All Washington, working with legislators from the Seattle and Tacoma area. It received no action, and it was reintroduced in 2013, and in 2015, and in 2017, along with a slightly different bill called the Healthy Washington Act. That was more or less a copy of what had just been introduced in California. Plus, there was another bill, SB 5701, that would have created the Washington Apple Care Trust, slightly different from the HCFA bill. HCFA organized an overflow crowd of some 80 supporters in January of 2018 at the Senate committee hearing for 5701. And it came within one vote of being passed out of committee. Activists also testified at the House hearing and worked with legislators to pass a budget proviso of $100,000 to fund a single payer and universal healthcare system feasibility study. And Bevin will say more about that in a few minutes. Slide 3, please. Yeah, we got that. So if you want to read some of this legislation, these 2 slides have the bill number and year, so they're very easy to look up. The WUST bill was last introduced in 2019 as HB 1104. Also in 2019, a separate organization called Whole Washington introduced a bill called the Whole Washington Trust and refiled a modified version in the next session in 2021. That was called SB 5204. The Whole Washington bills were based on the HCFA bill, but with numerous additional provisions, including a funding mechanism. So it was much more detailed. These whole Washington bills received no action either, so the group filed Initiative 1362 in 2021 and started a signature gathering campaign with the goal of getting it on the ballot November 2022. In contrast, HCFA's strategy was to continue with 1104, but leave the highly controversial financing part to the Joint Select Committee on Healthcare Oversight after the enabling legislation gets passed. But in 2019, after the WUST failed for the 5th time, HCFA shifted tactics, hired a skilled lobbyist, and pushed hard for the Pathway to Universal Healthcare Bill, SB 5822. And Bevin will discuss this in some detail, followed by Kelly, who will talk about the current commission. So I want to go back again for another year. A bill called Cascade Care was passed. It was designed to reduce barriers to care. It has been erroneously referred to as a public option bill. It's not a real public option bill, even though it was publicized as such. It was something that Governor Inslee was really strong about, and HCFA eventually supported it primarily for political reasons because the governor wanted it. It was strengthened by SB 5377 in the next session because the hospitals didn't want to go along with it. Again, it was strengthened pretty well. There are numerous other progressive healthcare related bills that will eventually be important parts of the single payer system were also passed in the last couple of years. And I just want to quickly run through them. 1272 requires much greater hospital transparency, providing more detailed reports concerning expenses, revenues, demographics, and charity care. And this is really essential if a single payer system is going to create accurate budgets and taxing amounts. It was followed by 2457, which established the Healthcare Cost Transparency Board, which will analyze the 1272 data. Private insurance and hospitals have been pretty good about not disclosing their detailed financial records, so it's very difficult to determine how much things really cost. So it's hoped that these two bills will help solve that problem. So slide 4, please. 5203 authorizes the state to produce, distribute, and purchase generic prescription drugs to help lower drug costs, and it also allows us to work with Oregon and California on the same system. 5052 creates health equity zones. 5532 establishes a prescription drug affordability board. 5546 caps the price of insulin. 1688 protects consumers for charges for out-of-network healthcare services, so-called surprise billings. That's in addition to the federal statute. 5589 measures that increases expenditures for primary care. And 5068 extends pregnancy Medicaid coverage from 2 months to 1 year postpartum. So a lot of legislative activity. That's not even all of it, but those are the most important ones. So slide 5, please. A key part of the WUST and the commission legislation is the provision that requires the state to pursue federal waivers as soon as possible. It's actually the first sentence in the current bill, but there seems to be a lot of confusion around the country over what obtaining waivers actually accomplishes. So waivers are a means through which the federal government can run experimental programs through a state before rolling them out nationally. They are typically for a specific type of project, for a limited but renewable time period, and they must meet certain other requirements. Medicaid waivers are specified in Section 1115 and 1915 of the Social Security Act 1965, so they've been around for a long time. Medicare waivers are specified in Section 402B of the Social Security Act of '67. And the Washington Healthcare Authority is currently working on what it calls the Medicaid Transformation Project. It's a huge project under a renewed 1115 waiver. And it's just now preparing another 1115 application for a Medicaid parity project for undocumented immigrants. Again, these will be very important pieces already put together once the single payer system is enacted. In 2010, as part of the ACA, the Center for Medicare and Medicaid Innovation was created. And it has specified several additional waiver opportunities under Medicare within sections 3021 to 3027 of the ACA. And section 1332 of the ACA permits states to apply for a waiver of the entire exchange program if they can propose their own program that, compared to the ACA, will provide coverage that is at least as comprehensive in covered benefits, is at least as affordable, covers at least a comparable number of state residents, and of course, does not increase the federal deficit. And it also, very importantly, permits states to use a single application to apply for waivers under a variety of different existing waiver processes, those that I just mentioned. So then once these waivers are approved, pass-through funding would be available. In other words, federal money for health insurance subsidies in the exchange program would flow to the state for distribution under its single payer program instead of through the private insurance exchanges. It is also hoped that money from Medicare would be run through the state instead of through the existing regional Medicare administrative center. This is really the only way a state single payer system can be financially viable, that if it pools all these funding streams together. But it's going to require a significant amount of negotiation with the federal authorities. Waivers under the Medicaid program will be much easier than for Medicare, since states already manage Medicaid with a mixture of federal and state funds. But the first step should probably be to follow Connecticut's lead in eliminating private managed care organizations from Medicaid, and then using the administrative savings and existing waivers to improve coverage and increase payments to practitioners. Connecticut has achieved some very impressive results this way through what it calls their Husky Health program. And I would encourage everyone to look into that. While single payer systems are not specifically mentioned in any of the existing waiver processes, CMS stated in a 2018 discussion paper that Health and Human Services wants states to, quote, propose other innovative approaches to meet the unique needs of their population, end quote. And they are recommending that, quote, states interested in applying for a Section 1332 waiver reach out to the departments promptly for assistance in formulating an approach that meets the requirements of Section 1332, end quote. And reiterating this, HHS staff met with Ash Karla, a California legislator, last October, and told him that the government was now very open to receiving Section 1332 waiver requests, specifically for single payer plans. And that while authorized legislation needed to be completed before applying, a full funding plan was not necessary for waivers to be approved. Slide 6, please. There is, however, one other major impediment to creating a state-based single-payer system, and that is state preemption by the Employee Retirement Income Security Act, otherwise known as ERISA. This 74 law, originally designed to prevent employers from refusing to provide retirement and other benefits when faced with state variability, has no waiver authority, even though the employer mandates in the ACA made many of its provisions irrelevant. While states can still regulate health insurance benefits and private insurance, ERISA has been interpreted to mean that they cannot regulate employer self-funded, AKA self-insured plans, where the employer is actually accepting the risk instead of an insurance company. Now, currently, over 60% of employer-based health insurance plans are but it has also turned out to be a great way for insurance companies to administer health insurance and make huge profits without the risks or burden of dealing with pesky ACA regulations. Fortunately, according to a 2020 law review article, there is a strategy involving 3 provisions that can be added to a state's single-payer legislation in order to capture employer health benefit expenditures and transition them to the state single-payer system. The most important is funding the system largely through a payroll tax, which is out of ERISA's reach. The second piece involves restricting the providers from billing anyone but the single payer for services rendered. So, assuming the state plan will have superior benefits, this further encourages employees to voluntarily drop their employer plan in favor of the state plan. And the third piece involves a convoluted mechanism for allowing the single payer to pay an employee's medical expenses and then seek reimbursement from the employer still responsible for those expenses. Now, no one really wants to use that kind of a process, but if it's included in the legislation, it could be there as a backup. With these 3 provisions, the authors expect that a state will have a very good chance of prevailing in the anti-single payer ERISA litigation that will most certainly occur. So in conclusion, I want to say that 1 or 2 successful state-based single payer programs will dramatically increase the chances that a Medicare for all single payer system will be adopted nationally. These efforts may seem like they are sapping energy away from the national movement, but they are actually making the national movement much more viable because it is simply too risky for the feds to implement such a massive change without having some initial successful demonstrations done by a state or 2. It is also much easier to mobilize and organize volunteers for local statewide projects than it is for strictly national efforts. But patience is certainly needed since there are a lot of moving parts and complications, and it's going to take a few more years before the first state breaks through the logjam. We think Washington, with its long history of progressive healthcare reform, stands a very good chance of being there first. Thanks.
Terrific, Cris. Thanks so much for that fairly detailed discussion of your history up to the recent history and developments at the grassroots level, which Bevin's going to pick up now. Bevin?
Thanks, Chuck. And just want to check in with Ben. I sent you my slides, but I can also just do it here. So what's best for you?
Are you a co-host? You could
Okay.
just screen share yourself.
Yep.
Okay.
Will do. Okay. So my name is Bevin McLeod. I'm co-founder of Alliance for a Healthy Washington here in Washington State. We're a 501c4 nonprofit, nonpartisan organization formed out of seeing the need to really streamline the advocacy in Washington State. Saw that there were a myriad of organizations and individuals who all are very much in strong support of getting to universal health care, but may not have the bandwidth to really organize and streamline their advocacy efforts to focus their sometimes minimal budgets on making sure that transformative policy gets across the finish line, much like Cris outlined. So really saw an opportunity to say, well, you know, we can't raise the status quo. We're going to have to out-politic the status quo. And so took the opportunity to form Alliance for a Healthy Washington. And so just wanted to chat briefly. I mean, I often talk a lot about many of the things that Cris already covered. And so I really want to talk today about just kind of the political roadmap to getting to a lot of the finishes that Cris articulated, talk about the timeline and the strategy and how we decided to kind of break it into chunks. So as Cris talked about, we had the Washington Health Security Trust bill that was reintroduced in the legislature many times over through the early 2000s into the mid 2000s. And in 2017, I started working for Healthcare for All Washington and really decided to help dig my teeth into getting it passed. What we found was that there were still folks in the legislature who were not ready to pass a fully comprehensive single payer system in Washington state. And so the feedback that we got was, well, you know, we have some champions in the Senate, we have some champions in the House, and we know that there are many people in the broader public who really want this and are ready to see change, but we just can't get the whole kit and caboodle across the finish line in one go. So how can we break it into pieces? So in 2018, we started breaking it into pieces by passing the Washington State Institute for Public Policy's proviso, as Cris articulated. That was able to kind of demonstrate by the researchers that were tasked by the state of Washington to do the research and provide options to the legislature that we could then continue with the momentum and say, hey, look, not only do you have research from a myriad of economists around the country and around the world, in fact, and you also have research that has been done now by the state of Washington itself and able to show the legislature that it's doable, it's feasible. So from 2018, then we were able to create the Pathway to Universal Healthcare Work Group. And part of my thinking at that time was, you know what, we have all of these folks in a myriad of different, you know, areas and policy that will say, oh, we weren't at the table when these decisions were made, or we weren't at the table when these conversations were had, you know. And so part of the thinking at the time for us was to say, well, let's make sure that those voices are at the table. And let's make sure that even if they are disparate, and even if we can't all agree, that everybody's voice at the table is heard. And so we developed the Pathway to Universal Healthcare Work Group, which we started out as a bill, and it ended up being a proviso, fully funded proviso, which is fine. At the end of the day, the Speaker of the House sat down and would only speak to me and my colleague, Nicole Gomez. And he said, well, I don't want to pass this as a bill, but I'm open to passing it as a proviso. And I said, sure, Mr. Speaker, whatever is going to get it across the finish line. So we did. And that work group had 37 members on it, myself included. Kelly, who you'll hear from shortly, was also on this work group, but it included patient advocates, community health advocates, large and small business advocates, healthcare providers, facilities, insurers, state agencies, you know, legislative representatives from both chambers, and from Republicans and Democrats, immigrant and refugee representatives, Department of Health, Office of Financial Management, labor. I mean, literally everyone we could think of was at the table. We had tribal members and tribal nations at the table as well. In Washington state, we have 29 federally recognized tribes. So they are really a key a group of folks who need to be at the table in these conversations in Washington state. So through 2020, and of course, as everyone knows, the pandemic hit. And so Kelly, I think we had 2 meetings, maybe 2, maybe 3 before the pandemic hit, including one where we had to vacate the building early because of a bomb scare. But we sat through the global pandemic on Zoom every single month and met. All of us. And we had robust dialogue, we had robust conversation, but we had economic analyses that came out. We had, you know, 3 different models that I think Kelly's going to go into in more depth come out of that work. But at the end of the day, what we had was a group of diverse stakeholders who all were invited to the table. And so to that key point, in terms of political strategy, that was, I think, a pivotal piece as well, was to say, hey, listen, we may not agree on the time, we may not agree on the model 100%, but everybody was here to say their piece. So 2020, we did this work group. What came out of the work group? Well, recommendations, of course. And so one of the key recommendations that came out of that work and that effort was to install a commission that would continue the work of the work group. So that is what we did. On the very heels of the recommendations that had come out of the work group, Nicole Gomez and I sat down and hammered out the beginnings of what became the Permanent Universal Healthcare Commission in Washington State. And we brought some folks to the table who, of course, had participated in the work group, and we found our legislative champions. And we said, hey, let's keep building on this momentum. And part, I think, too, of seizing the moment was being in the middle of a global pandemic and being able to say, look, right here in play in front of us, we see a healthcare system that is unsustainable for everybody around this country, including residents of Washington State. And we were able to look at, the roadmap that Cris provided in terms of legislation in Washington State and say, hey, it took us, I think, 20-ish years to get to cover all kids in Washington State. But when we put into RCW that the legislature intended to cover all kids, after that, it took, I think it was 7 years for full implementation. So we decided, okay, we want to learn from that. We want to take that. And what we did was we input that into the intent section of what became the Permanent Universal Healthcare Commission. So I want to talk a little bit about finding your champions, because I think that is really key in terms of political strategy. We were able to identify 3 specific legislative champions who really stood out for us over the years between 2017 and 2020, who were willing and able to take the political risk in their own caucuses and really be banner holders for this. And the feedback that they gave us was, give us the political will from the outside. So we did. And so that's the external political strategy to help push the internal political strategy, right? From my perspective, if you can identify legislative champions, that means that they're going to need support. And the way that they need support is through constituents. They need support through organizations and stakeholders who are willing to show up and testify, who are willing to sign op-eds and create earned media so that they can feel supported in going to bat internally in the political structure within the caucuses. So from my perspective, this is almost like running an initiative or a statewide political campaign, except that the politics, the initiative is actually a bill. And so I would say that, for anyone who's looking to do this at the state level, that's what I would encourage you to do, is think about how can you get the earned media that really highlights the impact of bills like Cris outlined that can help demonstrate that this is something that warrants a next step. From there, we had to win the support of the chairs of the healthcare committees. So again, I think figure out who are your gatekeepers, right? Who are the ones who have been there forever, think that they know the right way, are going to tell you how to do it and when to do it, et cetera. And I will say this, after years of pushing on the Washington Health Security Trust, and after years of having especially Representative Cody be in a space as a chair to say, nope, I'm not going to give it a hearing. I'll give it a post-session hearing and we can talk about it and have, in-depth conversations, but I'm not going to give it a hearing during session because she knew that the legislature wasn't going to pass it. So after years and years and years and years of trying the same thing, when we decided to try it in a different way, That really, I think, started to mean something to Representative Cody. And after we were able to get 2 wins across the finish line and show the grassroots support over and over and over again, I think that really caught Representative Cody's attention, to the point that when we brought the Permanent Universal Healthcare Commission bill in front of her, and we started in the Senate so that we could build that momentum all the way and make that runway all the way over to the House, she had no choice but to give it a hearing. And I will tell you this, not only did she give it a hearing, but she made this bill, she helped make this bill probably the strongest universal health care bill in the country in the last decade at least. And I think it's been challenging to kind of, as a universal healthcare advocate, it's been challenging to hear from her that she supports universal healthcare, but not see her act on it. And I think from my perspective, seeing her act on it, that in 2021 cemented for me that she actually genuinely cares, but she needed to see that there was a different political tactic at play. So the ways in which she made it stronger was that she made it permanent. And in the original version that we submitted to the Senate, we actually did have it as permanent. And then the Senate staff said, I don't know if we can make that happen. So they decided to kind of take out the permanent piece, and she put it back in. Not only did she do that, but she said, no, this commission doesn't need 2 years to do their report. I'm giving them 1 year because we already have the data. We already have the research. All we need to do at this point is synthesize those analyses that have already been done. On top of that, she actually put in a line on the very last page that blew my socks off, which is that she gave statutory authority to any state agency that has statutory authority, to adopt any recommendations from any report from this commission. So what that means is that any agency with statutory authority, so the Healthcare Authority, the Department of Health, the Office of the Insurance Commissioner, can, if they so choose, adopt any recommendation that comes out of this commission. And that, to me, in and of itself, demonstrates the strength of this commission and the commitment of this legislature to actually do this work. So I won't go through the nuts and the bolts on this because I know Kelly's going to do it and I know Cris has talked about it. But wanting to look ahead a little bit and say 2022 to 2023, what do we need to do to get this across the finish line? Well, from my perspective, this is kind of like, all right, we almost kind of just made it past the primary, if you will. And now we gotta get this piece across through the general and win. So how are we going to do that? Well, we have to adopt the commission's recommendations. We have to continue at the grassroots level, at the advocate level, to push legislators to adopt the recommendations that come out of this commission's work. So that means lobbying, that means grassroots support, that means, showing up to testify, that means people calling their legislators and saying, hey, we want you to adopt these recommendations. That means getting the earned media, signing op-eds to make sure that the recommendations that are coming out are highlighted by folks who are professionals in this space and who support this can get on board. Support legislative candidates who support universal health care. We're looking at a huge mix-up this year in this cycle. We have a mass exodus of legislators in our legislature. So what we have in front of us is a challenge and an opportunity to make sure that we identify people who are running for office who will be champions of this issue. And so that is one of the pieces as well, is to make sure that we are asking people as they step up to run for office, are you going to help to work to implement the recommendations of this commission? Make sure that the Healthcare Authority, we're holding their feet to the fire, Cris, for these federal waivers. I know there's a back and forth on this, but you know what? If we can get Ro Khanna's bill, or at least pieces of Ro Khanna's bill, the State-Based Universal Healthcare Act across the finish line, that will be monumental in helping states like Washington that don't have an income tax. It's actually unconstitutional for us in this state to have an income tax, be able to demonstrate the political and create the political will in the legislature to continue to expand our healthcare access and implement the recommendations from this commission. So having those federal dollars, having the federal waivers, I think is a key piece of the political strategy. And public engagement, testimony, earned media, which I already went into. So that's kind of in a nutshell. I always like to ask questions, and I know this is a pre-recording and a plenary, but part of learning, I think, and engaging with folks is the Q&A. So I look forward to that this next weekend on the 2nd and the 3rd. And I also welcome any questions that folks may have. Feel free to email us at Alliance for a Healthy Washington. And I think with that, I will pass it over to Kelly.
Yeah, great job, Bevin. And yeah, let's double down on encouraging folks to attend that workshop where we can get a lot of exchange going back and forth, what we can learn from what Washington State's done and demonstrated. Kelly Powers, you're up.
Great, thank you. Want to get my slide deck up here. I'm going to talk about the Universal Healthcare Commission and how we're actually engaging with it now. And hopefully I'm going to impart some tips that you find useful. So this is a pretty nuts and bolts session. I belong to Healthcare as a Human Right Washington, a growing community labor grassroots coalition of 60+ organizations and individuals fighting for single-payer healthcare at the state and the national levels. So we work towards multiple simultaneous paths to reach the ultimate goal of Medicare for all. And we kind of tack back and forth as the political opportunities change. We keep pressing on all fronts, trying to make breakthroughs. And as you've heard, we in Washington are fortunate because our state has been dedicated to improving healthcare for decades, and we have amazing leaders. So we have a lot to draw on. Super exciting. Bevin mentioned the Washington Health Commission and how it was designed for success, but I just wanted to point out a few key things just in case you get the opportunity to devise a commission yourself. Excuse me, my voice. Bevin mentioned how key Representative Eileen Cody was to making sure that this commission would not be doomed to producing a report to collect dust on an empty shelf. And so it's permanent and it's funded. It has 15 members with 3-year staggered terms. It has federal waivers or a stipulation that once federal waivers are available, that the state has 60 days in which to apply for those federal waivers. And as Bevin said, we're super excited about state agencies. If they have the authority, they can bypass the legislature and carry out the recommendations of the commission. That is really powerful. And then there's also advisory committees as part of the Washington Universal Healthcare Commission. And we see those as great opportunities for expanding representation and getting people with like-minded people on those advisory committees. And also, I think that they're key to getting the commission really focused and rolling up their sleeves and working. So those haven't happened yet, but we're really excited to see how those turn out. I also wanted to just back up a minute and say that as Bevin described, that there were many stakeholders at the table, which was really important because they've said their piece. We know what a lot of their objections are now. However, we did coalesce and make a recommendation for the single payer plan that we in the end would like. But the commission is a little different. Its focus is so, it has a clear deliverable for submitting a plan for universal healthcare system. And so we find that the members are more geared towards that. We're not arguing about whether we should have a universal healthcare plan. We're arguing, how do we make it happen? So that being said, we have 4 legislators, 2 from each major party. We have 5 state agency representatives responsible for equity, healthcare delivery, and insurance, and 6 members of the public, including the chair, who were recommended by universal healthcare advocates from Healthcare is a Human Right Washington and other member organizations. So that is super exciting. And also what is legislated, what's in the bill is super important too. So this will make us all feel nice, warm fuzzies. Of course, access to healthcare, universal coverage, reduce healthcare costs, reduce health disparities, improve the health and well-being of patients and consideration of the healthcare workforce, improve the quality of the healthcare. So there's a lot of good packed in that bill. And super, super duper important is its legislative charge, which is the preliminary, I gotta move my little box so I can read. The preliminary infrastructure to create a universal healthcare system that provides coverage and access for all Washington residents and a unified financing system once the federal authority has become available. So you can see why we're so keen on getting this waiver situation figured out and perhaps getting parts of the state-based Universal Health Care Act passed in whole or in part. We talked about the baseline report, and we're very thankful that Eileen Cody said, just you have 1 year to get that done. That was a brilliant move, because I could see now from where we are today how that could take forever if we let it. But I wanted to point out that, like as Bevin said, that the thinking really is we have all the research, pretty much all the research we need. We just need to get going. And one other really interesting thing about this bill is that we're supposed to work on implementable changes to the state healthcare system, financing and delivery system now to help people who are still falling through the cracks. But the bill directs us to do that in a way that is in harmony with universal healthcare efforts. And this is just brilliant because it blocks our opposition from thwarting our efforts by, throwing landmines on current things that we're trying to do. So that is very powerful. And then also the state of Washington has a healthcare cost transparency board, which several of our states, in fact, I think Oregon has been working on this too. And we're really excited about that because we're definitely going to uncover the costs in the private sector and learn. I think it will really help us tighten up how much money we're really going to be able to recover. So that is super exciting. And then we're going to identify the key design elements of a universal health plan. Of course, we need to do that in order to make one. Now, I want to turn to our coalition and advocacy work and how that's rolling right now. So in my view, we are just building towards the inevitability of UHC. It's not a matter of if, it's a matter of when, because as we know, we're living under an unsustainable system right now, or if you can call it a system. And to that end, we all know that, well, the permanent nature of the commission means it's not going away anytime soon, but it also means we have to inject some urgency in the process. So that's one of our tasks, and we are on it. And of course, we can't show enough support for this. Our charge is always to build an even broader support for universal healthcare and very visible. So we're building a visible coalition and advocating for solutions to policy and political roadblocks. Oops, I went too far, sorry. So I just wanted to touch base on what the model was that got the most support, over 70% support from the work group that Bevin was talking about. And that is, it's coverage designed and administered by the state. The care is delivered as it is now by private and public providers, clinics, and hospitals with no networks, however. And all Washingtonians covered by the state plan are covered by the state plan or an existing federal or tribal program. And so this begins to tackle equity, affordability, and underinsurance, the huge flaws in the current system. And they ran some financial modeling, and it came back that this plan would save $1.56 billion in total public and private healthcare spending in the first year and $5.5 billion annually thereafter. And we didn't get to pick the financial analyst. This was an outfit picked by the state. So we didn't get to slant it at all. These are very objective numbers. And let's see, going back. I just wanted to let you know about some of the cost assumptions in that model that we prefer. It included essential health benefits, vision, no cost sharing, dental and long-term care for Medicaid eligible only, which is not something that's ideal, but that's where it landed. And then it includes Medicaid, Medicare, CHIP, private health insurance, and undocumented populations. And it definitely capitalizes on savings from administration costs and purchasing power. One thing that happened in the work group was this chart, which drove me crazy when it first came out, because what it shows is Model A was the plan that I've just been describing in great detail to you. The state designed and administered under a single unified system. Model B is the variation of that. It's designed by the state, but it's outsourced and it's administered privately, like our Washington Medicaid system, and maybe some of your states do that as well. I don't know. And then Model C is the status quo. And what the consensus was, they trotted this out and said, C, Model A, totally unfeasible. We can't do it. And you're looking over at Model C and saying, what in the world makes Model C so feasible? I mean, I understand it's political, but that's our task. Our challenge is to build the case for the feasibility by convincing people that Model C is actually incredibly unfeasible because of all of its drawbacks. So I share that with you as a motivator. That's our job. We got to flip those colors. And also, I just do want to point out, it just drives me crazy that affordability is a yellow. It definitely should be a red. I think you would agree. I also wanted to talk about some of the crucial elements for building towards an inevitability, and that it would be a focus on health equity. We know it's very clear, short-term profit-driven companies making money by denying care is just inherently inequitable and unsustainable and much more expensive. It's really important to partner with labor and address their concerns through ERISA, and now workforce issues are really huge, and we gotta keep on top of those. And then building the grassroots support and involvement that we've been talking to you about. And so how do we advance? How is this coalition? How are we advancing our goals? Well, we're doing that through people, policy, and meetings. So we've dedicated a team, the subcommittee, to concentrate on the commission. We found that in the swirl of everything, Build Back Better, you know, all the stuff going on, Medicare for all, at all times, that it's just really important to focus a couple times a month and be strategic and thoughtful about what we're doing. And we have lots of side meetings as well to get information from other people involved in the issue. And we have to harness the power of that 60+ organizations and individuals across the state. And we're working behind the scenes with commission members, legislators, agency staff, coalition partners to learn the sticking points, develop and build support for our solutions and goals. And in terms of policy, we make good use of existing policy and work that has already been done. We push current initiatives in the legislature and state agencies to set us up for universal health care in Washington state. And we evaluate any proposed health policy with 2 questions. Will this advance universal health care? And if not, how could it? What could we recommend to make it better for the eventuality of universal health care? In terms of advancing, did I move that slide? No, I did not. Okay, let's see. Meetings. Okay, so we, as Bevin said, it's super important to actively participate in the commission meetings and push the urgency of the work and bring forward people with an array of lived experiences and expertise during public testimony. I did want to point out that is an incredible way to build your coalition, because as you're reaching out to people that maybe you're not as familiar with, but you know are really important, it's a great way to get them working with you. And it's important to engage and educate the public through media, through education programs and updates. And also it's a little boring, but it's really, really important to pay attention to the process. For example, is voting allowed, or is it a consensus model? What is it a simple majority if it's voting? Those kinds of things are real. Your proposals can live and die by that. When is the public testimony? We're finding it's better at the very beginning of the meeting and then maybe right before a vote. to address the issue that's being voted on. And also, it's really important to know if you're going to get to review drafts before they go out to their final copy. Deadlines are really important. Are you getting information in a timely way? So if I can get this next slide going, I don't know why it's not going. Okay, there we go. We feel that it's all coming together. We've got this strong bill forming the commission. We've got great commission members. We have existing bills and policies ready to work with. We have the potential of multi-state coordination. We have a strong coalition deploying inside-outside organizing, and it's not on my flat slide, but it's very important, is favorable leadership in the Washington state government. So yeah, like Bevin and Cris and Chuck, we're all really excited to talk more with you about this and learn about Oregon during the workshop. Thank you so much.
Unmuting, right? This is our life in a pandemic reminder. Unmute, Chuck. Thank you so much, Kelly. That was wonderful. Appreciate your energy, your passion and commitment. Same thing, Cris. Same thing, Bevin. Really a great team. I've learned a lot today, and certainly we do, as Kelly said, want to invite folks back the weekend of April 2nd, 3rd. Join our workshop where we'll be hearing also about our friends to the south of Washington State, Oregon, who are on a very similar path and have exciting news to share with you all. And that'll be an opportunity to bring in your questions, comments, so that we can have a rigorous discussion and to bring this forward. Last thing I'll say is one of my favorite quotes, Charles Alexandre de Calonne, right, said 7 years ago, "The difficult we do immediately, the impossible takes a little longer." We're going to win. We are going to win. We're going to model this for the nation. We're going to carry the ball forward, or in this case, carry the apple forward. Thank you so much for joining us today, and look forward to seeing folks at the roundtable workshops. And special thanks to Ben Day and Jillian Mason, who helped to chart us to this point right now to help keep us coordinated and on task. And also a special shout out to David Loud, who really helped to facilitate this meeting of folks. David's a real strong partner, and pay attention, if you would, to the work that's happening in getting, the state-based universal healthcare bill across the finish line. Ro Khanna's bill, we'll talk about that more next weekend. So thank you so much, and thank you folks for being with us.